So if you have frozen shoulder and you're in perimenopause and maybe you have gluteal tendinopathy or Achilles tendonitis or plantar fasciitis, or you feel like you have a frozen hip or you feel like you have a frozen ankle, welcome. I'm Dr. Wendy. I'm a physical therapist. I'm friends with Dr. Mary Claire Haver on the line. I like to say on the line. And I went to go comment on one of her videos because people were asking all these questions that I have answers to. And it would not let me reply to my friends, people's comments with videos. So I'm going to make an all-encompassing video about all those orthopedic things that you ladies are asking about as a women's health physical therapist that takes care of people like you. Okay, here we go. For the record, I feel like I'm Bethany Frankel and I don't think I could do this. I cannot eat and talk and make a video. Okay. If you're a female and you're in perimenopause, I have to remind you that your body is truly changing. Your estrogen helped broker your inflammation. Your estrogen helped you remodel those tendons. It helps you make muscle. And it's a host of things. It helps you deal with the cortisol and the true chemical inflammation in addition to the remodeling. When I talk to you about you literally have to change what you do when you enter perimenopause, it is not a joke. I'm not being an alarmist. I'm telling you we have to do a few things consistently. Number one, we have to maintain full range of motion of our joints. Read that as joint mobility. This can be yoga, it could be Tai Chi. Sometimes I think Pilates can be mobility, but we have to maintain the motion of our shoulders, our hips, our ankles, because we kind of get in these movement ruts, like you do the same thing every day. You're not like a kid, you're not getting up and moving all these different directions. Kids move in all these wackadoodle ways, and we are not moving in a wackadoodle wackadoodle way. Unless you're Lisa Renna and you're making those dance videos, I'm convinced that's why she does it. So tendonitis comes on in general when the muscle is unable to do what you are asking it to do. If it is not strong enough to control the load, so then the tendons have more and more force being placed upon them. They can't withstand it anymore, and tendonitis happens because of overuse and wear, and other people aren't doing their job. For instance, gluteal tendinopathy can happen because perhaps hip flexors are weak, hip abductors, the glute med itself is weak, perhaps the hip joint is stiff, the ankle might be tight. There's a host of things that can happen. Women have a higher likelihood, I think, of gluteal tendonitis because we have a wider Q angle than men. Also because women have the trauma of having children, and having babies makes her pelvis expand, and we have to shrink and expand and shrink. And honestly, some people are just more prone to gluteal tendinopathy. Just so you know, that lateral hip pain is more likely than not glute med or glute tendinopathy, because I know you guys all think it's bursitis, but greater than 80% of that bursitis is actually a glute tendinopathy. Tendonitis is an inflammatory, painful condition, and with every step you take, that glute is supposed to fire, and the tendon's rubbing, and there's lots of pain and problems. Frozen shoulder happens overnight seemingly because, well, if your chemistry is off because your hormones aren't right, your thyroid's not right, maybe you're diabetic, the inflammatory markers just rev up, and frozen shoulder is this wild thing where there's a thickening of your coracohumeral ligament. Your long head of your bicep runs underneath that, and that's why that pain refers down. That is primary frozen shoulder that happens with women in perimenopause. Secondary frozen shoulder happens post-op, or if you're casted, there's some mechanical underlying issue. Hormonal issues is the primary frozen shoulder. I saw another person talking about plantar fasciitis, same thing. The calf is restricted and tight, the ankle joint's tight, your intrinsics of your feet aren't doing its job, your glute med's not doing its job, you're maybe wearing the wrong shoes because maybe you're a lawyer and you have to wear heels in court, and so now your foot is stiff, tight, weak, and there's a host of things. But overall, chemically, your estrogen was helping to control your inflammation. Your estrogen also helped you with muscle hypertrophy. And if you weren't working on your range of motion and strengthening, and you were wearing these high heels, and there was nothing controlling inflammation, plantar fasciitis can pop up. And so inflammatory orthopedic disorders happen all the time. This is why I talk about yoga for women in perimenopause, because yoga has been shown to reduce cortisol and helps with range of motion. And I think it's a non-negotiable once you enter the menopause transition that you have to do mobility. But how much mobility do you need to be normal is the question we're asking, which, by the way, I'm doing another research study you can join. I'll post that later. But estrogen controls inflammation. Estrogen helps us remodel tendons. Estrogen helps us make muscle bulk. And so I am a believer of HRT for helping these things along with the mechanical changes that you think you need to do. Joint mobility and strengthening and changing your habits. and restoring nourishment and sleep and resting in it and not driving it like you stole it and getting the supplements that you need and actually taking omega-3s, and it's a journey.